and also I serve as director. And I wanted to thank you all first off for being here on such a beautiful day and with all the other activities that are going on and stuff. And also we want to send you to closing the meeting. As you may know, 1 in 4 adults experience a mental health experience in a year. 1 in 17 youth will experience, or 1 in 17 people will have a serious mental illness such as bipolar, depression, schizophrenia. 1 in 10 youth will experience a mental health condition that will interfere with their day-to-day life. And this is the reason why we're here today. We want to support those individuals who are touched by mental illness and make sure that they get the care that they need. As I said, I'm Jackie Golan, and I'm over the Advocacy Committee. And the mission of our committee is to advocate on behalf of individuals and families who live with mental illness for a comprehensive, well-integrated public and private sector mental health services so that people who live with mental illness have the opportunity to achieve their human potential and live the highest possible quality of life. What we do is we educate both the NAMI board and then also members of the community about legislatures and legislation and public policies that are going to help us achieve our mission. We also provide opportunities for NAMI members and other mental health advocates to meet their elected officials and share their personal stories and the needs of those with mental illness in our communities. Today we're going to touch upon 2 issues, the state budget and Medicaid expansion and transformation. We'll also hear from experts in the field about how to effectively communicate with your state legislators at the state capitol in Missouri. Jackie Lucas, the Director of Advocacy for NAMI St. Louis, will share some upcoming opportunities which you can meet with your state legislatures and share your personal stories and inform them of the needs of individuals and families living with mental illness. Again, I thank you all for coming out. It's a testament to your dedication, truly, because it is a beautiful day outside. And it's been raining all week, so I know how it is. And now, this is Jackie Lucas, she's going to do the introduction.
So thank you again for coming out today. We really do appreciate it. I hope we really do have some great experts on the topic. And first person that will be speaking today about the state budget is Jay Harder, and his biography is connected to the agenda that you have. And so I'm not going to do a big I'm not going to read that biography to you, but what I will say is that Jay has been tremendously helpful to NAMI and other organizations, grassroots organizations who do not go to the state capitol a lot. Jay is in the state capitol every day of the session, although maybe every day.
Oh, every day.
Every day of the state legislative session, which runs through January, or starts in January and ends in May. So he is able to tell us what we need to be doing to be more effective. So Jay, can come up and let us inform us about the state budget and some other activities.
Fantastic, Jackie. Thank you so much. Can everybody hear me okay? Oh, thank you. Can everyone hear me okay if I just speak up? Okay. Well, if you're having trouble hearing me, I've never been accused of being a quiet person. So if that does happen, feel free to do one of these. I will not feel bad, and I'll speak up to everyone. So the Missouri Budget Project, I'm the Public Policy Director for the Missouri Budget Project. We tend to focus on the numbers side of everything. So we appreciate organizations like yours who care about people. We try to give you the numbers that back up the information that you're giving on the individuals that are affected by the public policies that are being made in Jefferson City every single day. So we sort of look at both sides of the equation. We look at the budget as a whole and say to the legislators what needs to be funded inside the budget. We keep track of all of that for organizations like yours. I know Jackie gets updates from us on what's happening in the budget day to day. Alongside the budget process, keep in mind that that doesn't just run during the legislative session. There's been a lot of talk about restrictions, line item vetoes, things like that that have happened recently. And we have an incredibly in-depth presentation and some incredibly in-depth reports on how the budget process works. I'm not going to give that to you today. It takes a lot longer than 45 minutes, but feel free to visit our website, look at those reports, and you can get deep into that stuff. It's www.mobudget.org. Nice and easy to keep in mind. But what I really want to talk about today is what the state of the Missouri budget is, and some of the things that we've been doing to try to address what's going on in Missouri right now. So I'm going to start with the good news, which is the digging out of a hole, where we are right now. So first of all, the state budget is made up of approximate thirds in the state of Missouri right now. We have a third that's federal funds, so Medicaid, things like that that come from federal funds. We have a third that's earmarked or dedicated funds. Those are things that basically we pay a tax that is required to go to a specific thing. Conservation Department is paid with dedicated funds. Transportation, dedicated funds from the gasoline tax, things like that. That's the earmark. But usually, when we're talking about the state budget, we're talking about this third right here. General revenue, or GR, they call it a lot. And this is really what the state legislature, what the General Assembly plays with. When they're changing things, that happens in the GR budget for the most part. That's not to say it doesn't affect the other two things. GR does matching funds for federal funds, things like that. But for the most part, we're talking about GR when we talk about the state budget. So where does GR go? Predominantly it goes to education. K through 12 and higher ed make up the 45% of the state GR funds. So that's usually where most of it goes. But human services also gets 30%. A lot of this is matching funds for things like Medicaid, food stamps, TANF, those sorts of things. But that's all the human services. If you get down here to corrections and public safety, that's both of those departments together, that's only 8% of state GR that goes to those. And judiciary and elected officials, that's only 3%. So you start to see if you want to cut the budget, you can't get too far before you start hitting human services and education in the GR budget. So then where did that money come from? Obviously we have to get the money from somewhere, or else there's nothing to spend. So 68% of the state GR funds comes from the individual income tax. That's a huge portion. And that's been changing over the years, but it's gotten to be more and more, the state has become more and more reliant on the individual income tax. So if you mess with the income tax, the individual income tax, it's going to have huge repercussions on the state budget, just something to keep in mind. Sales and use tax is 21%. That continues to go down, and I can get into all the reasons why that happens. But sales and use becomes less and less of a percentage of the state budget. Individual income becomes more and more. Also, the corporate income tax is down to 6% of the state budget. That's been cut a lot over the last few years. So that's why that continues to go down. And all others up here is that 5%. That's the rest of the GR funds combined right there. So, like I said, this is still the good news, but we have basically gotten back to, in dollar for dollar, the amount that we were at before the recession started. So, yay, that's good news. The bad thing about that, however, is that inflation has continued to happen throughout those years. So since 2008, even though dollar for dollar we're back to $8 billion in GR, inflation has stripped the purchasing power of those dollars down to $7.2 billion. So even though we're back to where we were before, the purchase power of that is $800 million less than it was back in 2008. The Hancock gap. So the Hancock Amendment is this amendment we have in Missouri. It comes up a lot, usually talking about taxes. So the Hancock Amendment does two things. The first thing it does is it says that if you want to raise taxes, you have to have a vote of the people. You have to put it on the ballot. That's what most people talk about when they talk about the Hancock gap. But if you remember way back to the 1990s, Another part of the Hancock gap is if you hit a certain threshold, then every taxpayer in the state gets a check back from the state. So if you remember the 1990s, you got a check that was almost about the same as the postage on that envelope. And that was them sending that money back to you for taxes paid. And that's this right here, that little dip. Well, since then, there have been a few things that have happened, including 2 very large tax cuts. And so as of 2013, which is the last auditor's report on the Hancock threshold, we were $3.6 billion in GR below the Hancock gap. That's huge, and that was actually a really good year. So in 2014, you can imagine we'll actually go over $4 billion in that gap. So in real terms, from this point in the 1990s to now, the state has $3.6 billion less to spend than it did back in the 1990s. It's an important thing to keep in mind. This is actually a little bit old data, but we're getting new data, and so we send out this survey every few years. But back in fiscal year 2010, the state was only serving 1 in 5 Missourians with mental health needs. And that's actually going to be worse now, just so you know that it was then. In inflation-adjusted dollars, we're actually spending less on mental health services now than we were then. So just so everyone's clear, that's going to be worse than it was, but it's still pretty stark. So now we're getting into the bad news, just so everyone knows. So in all of their wisdom, the General Assembly said, since we're doing so poorly, we should cut taxes more. And so that's what they did. And so I have to confess this slide was done before veto session. So one of these lines you don't have to worry about anymore. Phew, the General Assembly did not override the governor's vetoes on the sales tax cuts. However, there was an income tax cut that was passed during the last legislative session, and that override has already happened. And that bill is called Senate Bill 509. It doesn't go into effect until 2017, but it is law on the books now. So that's that dip that you can see happening right there, is when we hit 2017, these income tax cuts start going into effect. And we have this gap as we go further out into the future. In 2023, that we'll have an $800 million gap from where we would have been otherwise. And just for fun, we did a little thought exercise, which we love doing spreadsheets at the Missouri Budget Project, so we went ahead and did one. We said, what if you were to fully fund the foundation formula in education? So that's the money that goes to school districts throughout the state. What if you were to fully fund that in fiscal year 2014 and don't pay for anything else, just the fiscal year 14 budget, which was last year's budget, plus fully funding the foundation formula? What would that look like? So in FY14, it would have been $439 million more dollars that you had to put into the budget. That's a sizable gap. But if you run that projection out over time, what it would cost versus the projected revenue growth after the Senate Bill 509 tax cuts, you get out to 2023 and you would need $2.1 billion more to reach that than what we have after the tax cuts are put in place. So it's a significant chunk when you start considering just what you have to pay for. So tax cuts, comparing Missouri to other states, the reason that tax cuts came up, let's be very honest, was because of Kansas and Oklahoma. Kansas and Oklahoma have been cutting their taxes, and so the Missouri General Assembly and a lot of different groups who we tend to work against usually, but sometimes with, said if we're going to keep up with these other economies, if we're going to keep up with Kansas and Oklahoma, we need to cut taxes too. So we tend to look at the overall tax picture, not just whether one state is cutting and we aren't. So if we are already a low tax state, we have the 46th lowest taxes per capita nationally right now. That's pretty low. Our income tax is the 25th lowest. Remember I said we rely very heavily on the income tax. So that's the highest number you'll see. We're right in the middle of the pack for income tax. Our corporate income tax, we are the 45th lowest per capita, and you have to consider that there are 2 states below us in that don't have corporate income tax at all. So you can consider that as well. Sales tax were the 42nd lowest per capita in the nation. And then, because our taxes are so low, this shouldn't come as a surprise to anyone, we don't have as much money to spend as we would otherwise. And so our state spending is the 43rd lowest per capita nationally. Elementary and secondary education were the 37th lowest per capita. Last year we had the lowest paid teachers in the country. This year we no longer do. Mississippi dropped below us, so that's good news. Higher education, we're the 44th lowest per capita in the nation on spending on higher education. Corrections, and if anybody has dealt with the corrections system in Missouri, we do not fund it very well at all. We're 47th lowest per capita. And if you look at the food budget for corrections, we have the lowest food budget for our prison system in the country. And our weekly cost per prisoner for food is comparable to the next state's daily cost for food. That is how little we spend on food. And if you've ever eaten at any of the state prisons in Missouri, that's not food. Medicaid, we have the lowest eligibility allowed under federal law for Medicaid. So if you are a single parent with 2 kids, you can't make more than $292 a month and get Medicaid. And if you don't have children, you're not eligible at all. And that's not just if you don't have children, that's if your children don't live with you. So that's a major concern, obviously, moving forward, and something that I'll talk about a little later in the presentation as well. So who is eligible for Medicaid is the important question, I guess. Pregnant women up to 196% of the federal poverty level right now are eligible for Medicaid. And just so you know, I'm not going to talk too much about it, but this is the annual for a family of 3, and I just wanted to put the dollar number up there so that people could get a general idea. So pregnant women up to $38,788 a year can get Medicaid. Let's see if we can get to go. There we go. Children up to 300% of the federal poverty level. We have a very generous CHIP program, or Children's Health Insurance Program. So kids are eligible up to 300%. Over 150%, they have to pay premiums, though. Just so we're clear on that. As we said before, parents with children, it's approximately 18% of the federal poverty level, which is $3,612 a year. But that's actually, it's the TANF eligibility. So eligibility for the temporary assistance for needy families is the required eligibility for the federal, for the federal guidelines. And so it's approximately 18%. It's not exactly 18% of the federal poverty. People with disabilities, 85% of the federal poverty level. And they can actually spend down to that, and I don't know if anybody's familiar with spend down, but if you have disabilities or you're aged, you can spend money on services and get your income down to that level and then become eligible for Medicaid in this state as well. Blind service is up to 100% of federal poverty level, but above that, they're eligible for blind pension medical. And so anyone who that's above a certain percentage blind in the state of Missouri can get health services through the state. The problem with that, we are actually out of federal compliance because everyone with disabilities are supposed to be treated equally under the federal Medicaid program, and we don't do that. So we pay 100% of the cost out of GR for blind medical in the state of Missouri. The federal government doesn't pay any of that.
Could you expand on that a little bit? What's the disequity?
What was that?
What's the inequity in how we treat?
Right, okay, so, and you can see it right here between these 3, but 100% federal poverty level and 85% federal poverty level, that's the inequity right there, plus our blind pension medical above 100%. We've been deemed to be non-compliant since 2005 when the Medicaid cuts went into effect. All right, it used to be everyone was at 100%. Okay, so Missouri Medicaid coverage, who's on the program? The majority are children. No shocker there. We said that it was a generous program. Aged, disabled, and then this is just non-disabled adults right here. So the aged, blind, and disabled are all inside here. We tend to call it the ABD population. But then you have non-disabled adults and children as well, which make up the vast majority of the program. Actually, enrollees are mostly children and non-disabled adults. Did I miss one there? No. Okay. So then, just something to keep in mind as we go forward. While we have a lot of children enrolled, they don't cost very much. Kids tend to not have too many expenses. Non-disabled adults tend to not have too many expenses. So you can see the spending per enrollment group, people with disabilities are much, much higher. So they make up almost half of the spending, but they only make up less than 20% of the actual enrollees. So it's just something to keep in mind as we talk about the budget and Medicaid, that enrollee per enrollee, it's not necessarily the same cost. And obviously people with disabilities cost more. No surprise there. And so the sources of Medicaid funding, and I know this gets really confusing. There's a lot of stuff in here, including the provider tax. If anybody's ever heard of that before, the hospitals pay the majority, actually, of the state's share of Medicaid costs. So the federal government pays half of it. No surprise there. The provider tax actually is more than what state GR puts in. So just one provider tax, that being the federal reimbursement allowance, which is what hospitals pay, is actually more. That's $1.3 billion per year. State GR is $1.1 billion per year. So the state itself, the state budget, only pays almost 16% of the cost of Medicaid right now. It's sort of a sore spot for hospitals right now. They're sort of annoyed that they're paying so much. They don't mind paying that much. They just wish the state would pay a little bit more and cover some more people, is basically where they are. So something to keep in mind as I talk really quickly about the budget aspects of Medicaid expansion moving forward. I'm trying to make sure I'm trying to talk fast so I get inside the 45 minutes. So why does Medicaid expansion make sense is basically what this is about. The federal government under the ACA has said that they will pay, right now, 100% of the cost of Medicaid expansion, and over time they go down to 90% of costs. So this is a full state match right here. You can see that the vast majority is still federal funds there. But the state will have to pay 6.2% of the Medicaid expansion population once we get to fully phased in. And that federal reimbursement allowance, that hospital provider tax, and others will pay 4% of it. So even at fully phased in, state GR is only paying 6.2% of that cost. So that's an important thing to keep in mind. There's also this problem that was set up under the ACA. I'm not going to be one of those people who tells you that the Affordable Care Act was a perfect document. It was not. It was a rushed document. But we have this problem right now where we have Medicaid coverage over here, and you can see this single guy out there, he doesn't get coverage at all. But we have Medicaid coverage here, and then we have this huge gap with no coverage, and then you hit marketplace subsidies once you get up to 100% of the federal poverty level. So we have this gap in here where people basically have no options for health insurance. And I'll give an example that I just recently heard. This was about a month ago. A woman who is divorced, she has 4 kids, she makes less than $20,000 a year, and she went on the marketplace to try and get health insurance, all right, the exchange, healthcare.gov, I think that's the website. So she went on to try and get health insurance. Her ex-husband also went on to try and get health insurance. Her ex-husband makes over $350,000 a year. She makes under $20,000 a year. They got the exact same quote for the cost of health insurance. Because he makes too much money to get subsidies, she doesn't make enough money to get subsidies. So they would have to pay the exact same cost on the marketplace in order to get health insurance. Okay, so it's really...
I just have a comment. The original law would have required Medicaid expansion, and the gap is because of the fight from people who didn't want the Affordable Care Act. The original law wouldn't cover that gap.
Right, so the law still requires that we cover all these people, let's be very clear. The law requires that you have that you have Medicaid all the way up to 133% of the federal poverty level. So that would have, you're right, that would have covered it and even given some overlap for people to move between the two. But because in Missouri we haven't expanded Medicaid, that's why that gap exists. Thank you for pointing that out. All right, so then even at full state match, the savings from expanding Medicaid outpace the costs. Now that seems counterintuitive, I know. Why would you cover more people and save money? But you can see as we go through here, so this is the cost, this light blue bar, and the dark blue bar is the savings. And I'll tell you why that happens here in just a second. And this is that second. Okay, so I told you that people who are blind right now, we have to pay 100% of the cost. Well, they pay a portion of that too. Let's be very clear. There's a premium fund that comes out of the Blind Pension Trust. So there is a premium fund, but then all the rest of that we pay for directly out of GR. Well, if we accept Medicaid expansion, if we expand Medicaid while we're at 100% of federal match, the federal government will pick up the entire cost for that population. So that's pretty impressive, right? So obviously, that same person getting the exact same health care they're getting right now, it's just that now the feds pay for it instead of us. And so that's part of the savings that you start to see. And then even over time, it only gets down to 90%, right? So the federal government continues to pay 90% even out into the future. Well, then we have pregnant women as well, right? So the federal government right now still pays a big chunk of that. So we've talked about the provider taxes, and we only have to pay this little chunk of general revenue. The interesting thing about pregnant women is they don't stay pregnant forever. I just learned this, it's really interesting. And so you don't have the exact same pregnant woman in the program all the time. So under the expansion population, these are actually new enrollees when they become pregnant. And so they're allowed under this new expansion population, where again, the federal government pays 100% of the cost, going down to 90%, and the state never has to pay over 6.2%. So that's another savings that we have over time as you look at it. And so that basically putting all of those together, and I want to be clear, these are not the only two populations. The biggest savings from Medicaid expansion is mental health. And I have the full spreadsheet to show you what happens, but if we actually put people on insurance, it saves the state a lot of money. We spend a lot of money in our, well, not enough money, let's be very clear, but we spend money in our state budget on the Department of Mental Health on people that don't have health insurance but still have mental health. And I'm sure that as you all do your advocacy, as you work in your communities, you know that there are a lot of people with mental health needs who don't have children at home. There's a lot of people in the corrections system who have mental health needs, who don't have children because they don't live at home. And so those people aren't eligible for Medicaid, like I said before. No matter how little they make. They can make $0, they aren't eligible for Medicaid. But if we expand Medicaid, they get those services. Even people who are in prison get Medicaid. It's incredible if we expand. So that's where a lot of that savings on the mental health side comes from.
I just want you to phrase that a little bit differently, because there is a trend nationwide. I put a book over there. We're incarcerating more mentally ill than we are treating.
Right, absolutely.
And I would love to see Medicaid expansion here for lots of reasons. And one is so that our people who are locked up, can't afford to bond out, are waiting for a public defender, actually get decent psychiatric care while they're incarcerated.
Absolutely. That's a very good point. Very good point. And unfortunately, right now, that is the provider of last resort for mental health services for a lot of people, and that's a tragedy right now in the state. So if we can make sure that they get basically on an insurance product that will allow them to get those services, that it would be the best, most efficient way as well for them to get those services. So thank you for bringing that up. So what can we do? And this is always the thing that people come back to at the end of it. Wow, that's really depressing. What should we do to fix this problem? So the first thing is talk to your legislators. Please, please, please. That's the reason you all are here, to find out about talking to your legislators. I know we'll have some people coming up later to talk about how most effectively to talk to legislators. I cannot tell you how many times I talk to legislators who say, nobody in my district cares about this, because they haven't heard from anybody in their district about any of these issues. So even if you know that your legislator completely disagrees with you, I would say talk to them more than talking to the ones who do agree with you. I love hanging out in the offices of legislators who agree with me. I love talking to them. It's wonderful. We sit there and talk about how dumb everybody else is. But I don't do that very often. I need to talk to the people who disagree with us, who disagree with me. And I would suggest that you all do that as well, especially when you're talking about things like Medicaid and the need for mental health services being funded in the budget. I cannot stress enough how much mental health services have been decimated by this state General Assembly. This state budget continues. It seems to be the first place they go, and I don't know why that is, but it has been.
They're quiet, and the people that
Right.
need it can't speak for themselves.
Right, so that's the problem. We need to speak for them, right? If they can't speak for themselves, we speak for them. I say the same thing to child advocates. The problem with kids is they can't vote, so somebody else has to vote for them, right? Talk to your neighbors, talk to your coworkers. It's vitally important that those legislators hear from other people as well. So especially on issues like mental health that are considered taboo, talk to your neighbors about how important it is that they talk to their legislators about it. You have to build that groundswell from the outside in, and that's really what winds up happening, what needs to happen in the state of Missouri. So also join coalitions, and NAMI's really good at joining coalitions. They're sort of a coalition of individuals themselves. But there's really two big coalitions that are working on all of these issues. The Missouri Medicaid Coalition, which Jackie is on the steering committee of, has been doing a lot of work on getting the message out to the public that this is something that not only is it good for a lot of people, but it saves the state money. And that's a really good group to be connected with, and Jackie can talk to you about being connected with them. They're actually getting a lot of people on the ground. They're getting 5 new community organizers, 5 new community organizers starting the beginning of next month. There's going to be a lot of action going on around the Missouri Medicaid Coalition. The Coalition for Missouri's Future, we're actually, I'll admit, the Missouri Budget Project's members of both of these, founding members of both of these coalitions. But the Coalition for Missouri's Future focuses on the need for more revenues coming into the state, budget adequacy, making sure that instead of everybody fighting over a shrinking pie, that we actually grow the pie so that everybody gets the services that they need. So this is a group of businesses, educators, there's labor unions and CEOs that sit around that table. It's really funny to watch them. They're really tense around each other. But it's a really fun group to be a part of. So is the Missouri Medicaid Coalition. This is more nonprofit organizations, but also just a great group to be a part of. All right, so questions and comments. I think I left myself 10 minutes to answer questions and there you go. Yes, go ahead.
With all due respect, what do you think the reason is for opposing legislators? I'll say you pointed out, it hasn't been because it's with the Missouri Chamber of Commerce, organization,
Right. That's a really good question. So if anybody didn't hear, why is it that a conservative legislature hasn't done this if everybody supports it, including the Missouri Chamber of Commerce, and it saves money? So the reason really is politics, and let's be very clear about that. That's what it comes down to. And it's unfortunate because we don't do politics at the Missouri Budget Project, but I certainly talk about them with you. So the way that redistricting has been done, the way that a lot of things happen in this state right now, is because of primaries. There's been enough gerrymandering in districts now that most of the districts are either going to go to one party or the other, and there's not too much attention paid to the general election. It's more about who's going to win that primary, and then they'll win the general election. So there is a strong contingent, and there continues to be a sizable contingent of Republican voters who are adamantly opposed to the Affordable Care Act and all the things that are included in that. I'll be honest, the Missouri Chamber of Commerce is opposed to the Affordable Care Act. The reason why they want Medicaid expansion is they're already paying the taxes and fees that fund it. They just don't get anything for it. So, yeah, that's a really good point, but it comes down to politics, unfortunately. But the more we can talk about it, the better it gets. The sponsor of the Medicaid expansion bill right now in the Senate is a Republican, a conservative Republican, actually, from Kansas City area. He used to be the budget chairman. We sat down and ran the budget numbers with him so that he could see them. And he was opposed to it at the beginning of last session, and he was carrying the bill by the end of last session. So people can be convinced. I try my best to not be a partisan person and not focus on the politics. If you sit down and run through the numbers with enough legislators, and if enough people are contacting them saying it's okay to do it, I think we can get there. So thank you for the questions. A long answer to a simple question. Oh yeah, I'm sorry. I know you got to ask a question.
I just want to piggyback on that. I still don't understand what is their main objection. When you see the numbers that they said, why do they still say that? I know the politics is a big answer, but I mean, bottom line, why do they say that?
So we ran into a few big problems this last session. And one of them is statewide elections. We have a few key people that believe they will be running against each other in a primary in 2 years. And so the appropriations chairman in the Senate and the Speaker of the House believe that they will be running against each other in a primary for Attorney General. And they were sort of trying to out-Tea Party each other this last session, and so those two were butting heads, and in doing so, they killed the Medicaid expansion bill. I am convinced, I continue to be convinced, if we would have had a vote on the Sylvie bill, is what everybody's calling it, if we would have had a vote in the Senate on that bill, it would have passed overwhelmingly. Same thing in the House. If they would have had a vote on the Torby bill in the House, it would have passed overwhelmingly. But the Speaker of the House wouldn't let the bill come up in the House, because he didn't want to be the speaker when he's running for statewide office, that let that go. And also the appropriations chairman in the Senate vowed to filibuster any bill. He has been thought of for a long time as a really moderate Republican, actually, but he vowed to filibuster a bill if it came up. So that's the politics we ran into. That Speaker of the House is now gone, so that might help. He's no longer in office. There's a new speaker coming in, and we continue to talk to him about these issues. But again, it all comes back to politics, unfortunately. I have hope for this next session. I think we need to push really hard this next session, because if it doesn't happen this upcoming session, this January through May, I don't think it will happen for 10 more years, and that's really frustrating.
I still don't understand the major objection. If I get is one party getting together, what's the major objection? Is it that they don't want to help people? They don't think it's going to be work according to the numbers? I just want to know.
Instead of saying they've given.
Obamacare.
Yeah, that really is it. Just, do they want to parcel it away from the rest of it of Obamacare? You could split people apart and talk about this part of it. I think it would make a big difference.
Right, and you're looking for logic in a building. I mean, this will be my 15th legislative session. I have yet to win an argument with logic in that capital. Yes, go ahead.
What I always see when I read the articles that to me is, yes, it looks like it's free and we're passing up good money now, but we're afraid that it's all on, there's big deficits in the U.S.
Right.
And that they're going to end up holding a bag of commitments to continue to pay this. Now, I'm not taking the side, but that's what's continually the media puts in our article.
Right, and that's a valid point. And so the first thing I want to say is that these funds are dedicated. So it's paid for by these fees and taxes that businesses are paying right now. That we're paying for it. People, we're already paying for that to be funded. And it is dedicated funding out until 2020. So, I mean, that not only is it funded and that those funds are dedicated to go to this, it's already budgeted for. They don't have to pass another budget in Congress, and we know that's probably going to be a while till they do that anyways. They don't have to pass another budget for this to be funded. It already is funded in the budget until 2020. So that's good news. The other side of that whole equation is that what they're talking about, what they tend to worry about, is the expansion of current programs. Well, if you're concerned about the growth in Medicaid right now, that has a lot more to do with us not funding those things adequately, and that people wind up going to emergency rooms, to FQA, federally qualified health centers, community health centers, instead of going to the best places for them to go. And so that's really the growth in our current health costs, is because we don't have everybody coming. Yeah.
So, following up on that, is there any way that when we make an argument for this, that we give them a bailout in some way to assure them that their biggest fear is not going to come to be, which it may not anyway.
Right.
Because you get help from people, trying to be less community services.
Well, I would direct you to our report, which is called Medicaid Makes Dollars and Cents. It's S-E-N-S-E, it's really cute. Yeah, go to that report. It specifically deals with the Sylvie model, and it has a lot of, I stole a lot of the graphics from that report to put into this. But it lays out, and it has at the end this big spreadsheet that says exactly where all the savings are from expanding Medicaid. I would use that when you talk to legislators, because at least what we found when we've met with them, when we met with Ryan Sylvie, is if they dig deep enough into that, if you can get enough time, and it took several meetings, let's be honest, to get Senator Sylvie around to agreeing with us on this. They can't, if they get too far into it, they can't argue with the numbers anymore. It's simple math. And one of the problems we ran into early on was we tried to make this economic multiplier argument. I love economic multipliers, I believe in them. The General Assembly doesn't. So it's much easier to just go, you guys remember arithmetic, right? So here's this minus this equals this. And that's basically what you have to do, is walk them through one thing at a time. And I think that if they're being honest, they can't argue with the numbers too much further. It's called Medicaid Makes Dollars and Cents. And it's on our website, mobudget.org. Yeah, Jackie.
Yeah, can you talk a little bit about personal stories and what effect they have on our...
Absolutely. So as I said at the beginning, we don't care about people. We like that you all do, but we just talk about numbers. Yes, personal stories are incredibly important, especially for people who aren't getting health insurance. I know that Missouri Healthcare for All is gathering stories, and I'm sure that if you have a good story, you can give it to Jackie, and she will make sure that it gets to legislators. Legislators love those kinds of stories. Now, there are some of them that throw that back in your face, but the personal stories mean a lot. When you can put a face on it and say that it saves money, that's like a 1-2 punch that's really hard to ignore. So one of my best friends, he's actually my roommate in Jefferson City, is Brian Colby with the Health Advocacy Alliance. Nobody knows our names, but it's really fun to work with him because he does the personal story side. He talks about that face of people in your district who need Medicaid expansion, and I get to do the numbers. So if you have those stories, please give them to Jackie. They mean a lot when we're actually advocating in the Capitol. I know I've gone over time. Just 2 minutes. Perfect. Oh, I can keep talking. Yes, go ahead.
I just had an additional comment on how legislators care about this, and I know the Chamber of Commerce does. One of the huge losses that we're having in this state right now is the fact that if you're talking about paying taxes and it doesn't come back. It's something that hospitals care a lot about, called disproportionate share. And what's happening is our hospitals are losing those dollars. They're still seeing people in the ER. They're having to cut beds. My wife and I work at the practice that tries to find jobs for people. Been huge layoffs, not just in the rural hospital, but here locally as well. 200 staff at one, 300 at another. Our hospitals that serve our folks in most need are having to lay off people today. And that's in no small part because those dollars which are earmarked to help hospitals to take a larger number of folks who are on Medicaid or uninsured, those dollars are going to other states. So we're harming ourselves in multiple ways by serving a political purpose rather than a purpose constituent.
Right. That's very good point. Does everybody know what disproportionate share funds are? Good, because it took me a while to figure it out. But yeah, so it's basically these funds that the federal government gives for hospitals and other centers, the hospital, for caring for people that don't have health insurance. Well, part of the Affordable Care Act was we're going to cut, the federal government said we're going to cut that over time. We're going to get rid of half of the disproportionate share funds. And instead, you'll get everybody covered on Medicaid or health insurance, and so you won't need those anymore because you won't be seeing nearly as many people who don't have health insurance. Well, we took a 2-year reprieve from those dish cuts, but we're already seeing the effects of it. It goes off a cliff next year. I mean, we're in the next 3 years, we go down to 50%. They've only cut 12% so far, I think, but it just drops off really fast after that. So the other thing I'll say, and you made a really good point there, is that states that have expanded Medicaid are hiring people. We're laying them off, and they're hiring them. And they're hiring them for more than we can pay them. And this is completely anecdotal, but my fiance, soon-to-be wife, has family in the Springfield area. Her mom is a social worker, and she knows a lot of social workers down there. Arkansas health centers are coming to Springfield, Missouri, trying to hire away our social workers, and they're offering them 20 to 50% more to go move to Arkansas and do the same job. That's one of the things that not many people talk about in the Affordable Care Act. We need a lot of social workers to make this work. The mental health homes model, if anybody's heard about it, that BJC has a little bit of money to do it, the community mental health centers are doing it. It's incredible if you give someone a social worker who needs it, and just make sure that they take their meds on time, and that they get whatever services they need, it saves the state a whole bunch of money. But you need a lot of social workers to do that, and we're losing them right now to other states. We're starting to lose our health professionals to other states. So if you're worried about seeing your doctor, you should expand Medicaid too, because they're being laid off and picked up in other places. Yeah, go ahead.
I don't know that the paper did a story about that, I think it's the government, one of the Carolinas, but somebody died because the hospital was closed due to lack of funding. And the person that died, because the doctor couldn't get there to get him to another hospital, did have insurance. So it's not only affecting the Medicaid patients, it's affecting everyone in the state and not expanding their Medicaid.
Right.
It's the reason that the hospital was closed because they were on.
Yeah, no, absolutely. And it's a very small campaign that the Health Advocacy Alliance did, but it was Facebook ads, and I think they were so brilliant. It was, the campaign was called How Far Is Too Far, but it was focused on rural areas, but how far away can a hospital be before it's too far? And they had several examples. They had one for a woman who went to get her chemotherapy, and she had to go, basically, if you had to go from, it was a 2-hour drive, basically, to go up and get her chemotherapy, and having to stop to throw up on the way back. One of them was, if you fall out of a deer stand, how far is too far before you have major complications because you can't get to a hospital? And yeah, that's a major concern, especially these rural hospitals. This is a brand new thing. The big hospitals, because we haven't expanded Medicaid, aren't buying up those little hospitals anymore. They're sort of pulling back into their big, centralized hospitals like here in St. Louis, and not really expanding out. But those smaller hospitals are starting to crumble, and nobody's picking them up anymore. So it's a major concern, especially if you live in a rural area. Yeah.
Is there any dynamic story on the increase in jobs that the Medicaid expansion would create, the additional jobs and income mix, going about those people to stay back to
Right, and that's where those multipliers came from that I was talking about earlier. So, I mean, we have those reports. We don't spread them too widely because the problem is the legislators don't. So we try not to get too deep into that, but I mean, it is significant, over 20,000 jobs created. That's not just saved, that's created. You wind up saving about 4,000 jobs that are going away right now, quite honestly. But yeah, and then with the income taxes, everything else, it's that savings chart I showed you. Excuse me. This doesn't include increased taxes at all. This doesn't account for the economy growth. This is just moving people from one funding stream to another one. That's all. All right, any other questions, comments? Well, you guys are a wonderful audience. Thank you for all that you do. I will also say, Jackie mentioned earlier that I'm always in the Capitol. Feel free to contact me. I'll leave a few of my business cards here, but my email address is really simple. It's the letter J, and then my last name, Hardenbrook, which is not so simple. It's 11 letters long, but it's written on there, HARDENBROOK, at mobudget.org. And, I'm down to one card. I was actually out with some social workers last night, and they had great stories, so I handed out all my cards. But my phone number is 816-810-2066. That's my cell phone number. I will respond to any voicemails left, but text messages get answered immediately. So email and text is the best way to get a hold of me, especially during legislative. 816-810-2066. And yeah, feel free to contact me anytime. And the reason why I'm in the Capitol is for groups like yours. And especially if you have questions about the budget, that's what I do. So feel free to contact me anytime with any of that information. I'm happy to help. Thank you all so much.
Thanks, Jamie. Our next speaker, I just talked to him on the phone. He's on his way. So, do you want to take a brief break, or should I go forward with some other things that I was going to do in a break? Okay.